Well, good morning, everyone. This is Keith with Positively Osceola, another one of our DayBreak live shows. We are super honored to have so many wonderful guests. We are uh, just ultra blessed to be able to bring people in on these shows that are great authorities in a vast array of areas within the community. These days we talk a lot about COVID-19. Certainly, it's affected everyone's life the last year and a half plus. And so this morning we are just absolutely wowed to be able to have a very special guest with us this morning. It's going to be answering some questions about COVID-19. And no matter where we go in the community, I think what people are really trying to discern is, how do they move forward with the information that they trust? And so this morning is going to be a day or a morning where we can absolutely feel great about the fact that the information we're gaining today is correct and up to date and now. So I want to welcome this morning Dr. Antonio Crespo. How are you, sir?
Very good. Thank you, Keith.
Well, we'll give you the whole long welcome in a second. First, as we get some people popping in here from the always wonderful algorithms from Facebook. So how's your week been so far?
It's been okay. It's been, the last few weeks have been rough, but I think that we're finally getting a little bit of a I wouldn't say a break, but at least a more normal path.
Right. That's funny how we the word normal is a tough one.
I know. I was looking for the right word.
It's a tough one to have it come out of our mouths these days.
Yeah, the new normal probably.
And we cover a lot of football games throughout the Osceola County community all at the same time. Usually you're talking about Friday night football in high school. It's Friday night, it's Wednesday night, it's Thursday, Monday, because all the games are pushed around because of certain COVID protocols.
Something happened, yeah.
Yeah, so it's kind of like the rest of life,
Exactly.
So we're getting some people to pop on right now. So why don't we go ahead and we'll make it official. We'll come back and we'll discuss COVID-19 and much more. Okay?
Thank you, Keith.
All right. Well, again, we'd like to officially welcome our guest today, and that would be Dr. Antonio Crespo. He's the medical director with Orlando Health Medical Group Infectious Disease and also medical staff leadership chair with Orlando Health Dr. P. Phillips Hospital. And as the medical director of infectious disease for the Orlando Health Medical Group, Dr. Antonio Crespo provides guidance and leadership to his peers and the broader healthcare organization headquartered right in Orlando, Florida. He's responsible for promoting the goals of fighting infectious disease, including reducing the rates of infection and improving the health outcomes for patients with chronic infections through quality treatment and care. Currently, Dr. Crespo serves alongside a dedicated team that has prepared and managed the COVID-19 pandemic for many in the Orlando community and is familiar with diagnosing and treating deadly emerging diseases. That is obviously spot on to what our world and our communities are dealing with currently, correct?
Yeah, thank you, Keith. Thank you for having me and for that introduction. So I'm glad to be here and be able to provide any insight about COVID-19 and answer any questions that your followers could have.
Well, you're extraordinarily busy, probably more now than maybe you ever have been, given the environment we're all living through right now. Us being in a media scenario, we see so many different people from all over the community in Central Florida, and what we hear constantly. We were actually able to have we had a breakfast meeting in St. Cloud a few weeks ago with Dr. Sharma from Orlando Health St. Cloud Hospital. She was outstanding, and the people that were able to attend, it was a small group of people in St. Cloud that morning, but the folks that were there were so grateful because they felt they were able to go right to the source and say, okay, we're hearing so much different information from, whether it be national news and some things are maybe correct, some things maybe were not correct. Or so today it's a great thing to be able to speak to you. So if you're okay with it, I'm going to go right at it so we can
Of
make
course.
best
Yeah.
use of our time. So just a bunch of questions, and I sure appreciate you being able to be with us again this morning. So right at it. At this point, are there any reasons why someone should be hesitant about taking a COVID-19 vaccine?
Really, no reason. The vaccines have been on the market since December of 2020. Initially under the emergency use authorization from the FDA, after reviewing all the studies that had been done last year. And then recently, as probably everybody knows, the FDA approved at least one of the vaccines, the Pfizer vaccine. So there have been really billions of vaccines administered around the world. And this has been the biggest outreach of vaccines in the history. And given us at one single point, and that we can actually monitor them so quickly with all the technology and all the ways that we have nowadays to monitor. So after almost a year now of the vaccines on the market, they are very safe. They are very effective. One of the most effective vaccines that we have out there, and they really no reason for concern at this point. So some of the concerns that people could have had at the beginning, which were very reasonable, new vaccines, people could have said, they were done very quickly, and was the research really, so meticulous? And it's reasonable to have those concerns. But at this point, I think that the real life evidence is overwhelmingly positive, and it is really the best way, if not the only way, other than reaching for natural immunity, which it would be, very, very painful and difficult for everybody. It's really the best way that we have to get out of this pandemic.
Yeah, I'll speak personally for a second. I know my wife and I and my son, we were traveling a lot because we do some business up north. We traveled a lot in the earlier stages before there were vaccines. And we were very, very, very careful, but we had to travel. My son's 21, and so we felt comfortable about it. But that was before vaccines. And I look back, I think I had a conversation with someone about a week ago. I look back and I think and basically what you were just saying, where would we be today if vaccines had not come out? This would be a very different environment we're living in.
Exactly, and to put it into real numbers, what we have seen this summer, the last few months, it was basically with about half of the people vaccinated and half of the people not vaccinated. So this significant amount of patients that we saw in our hospital, that we are still seeing in our hospitals, and unfortunately many of them having bad outcomes and dying. It was in half of the population. So imagine if it would have been the entire population unvaccinated like we were last year. So it really made a big difference.
Yes, absolutely. A great point made. So we have people ask us this question. Does the vaccine or vaccines, does the vaccine contain COVID-19?
No, it doesn't. So these are not live vaccines. There are some other vaccines that they have live virus, and the idea is to basically trick your immune system to make antibodies. But these vaccines, especially the ones that we have here in the United States, they use a technique that basically gives your immune system the information to develop the antibodies. That all they do is like a code. It's giving you a code to develop the antibodies, and that's it. There is no live virus. There is no risk of getting the disease from the vaccine.
From the vaccine. I know. I think that's an easy one. Early on, people thought that possibly that was the case, but understood.
Yeah, easy, exactly.
So how about someone who has been infected with COVID-19? Do you still encourage them to be vaccinated?
We do, and again, that's a very good question, and we get that question a lot, and I think it's very reasonable because people say, well, if I had COVID, why I have to get vaccinated? I already, pay my dues and suffer through that, and now I should be okay. And the reality is that they are okay, they are protected for a while, and that is the reason why it is a good idea to get the vaccine, even if you had COVID. The vaccines will give you a more planned immunity, I should say, and then if later on we need to get a booster, like right now is being offered for some part of the population, 6 or 8 months after they completing the immunization, then you are into that schedule, and it's more predictable. I should say your immunity would be easier to predict. Once you have the infection, you get natural immunity. It does last a while. We don't know exactly how long yet. This is a new infection. It does last a while, and that's good news, because between that plus the vaccines, we could be getting to the point of what people know as herd immunity, and maybe that in that way, at that moment, we can get out of this pandemic. So, but again, it's unpredictable. We don't know how long it's going to last. It could be 6 months, 9 months, 1 year. But with the vaccine, you get into that long-term protection, and any schedules that come up later, you'll be part of that. So I think that it is definitely a good idea to get the vaccines, even if you had COVID-19.
Well said. Let me complicate that question even further. So how about somebody, and I've heard this a few times, where somebody has been fully vaccinated and then they've had a breakthrough infection. When they realized that they tested positive, did a rapid test, however they did, they tested positive for COVID. So they're like, wow, obviously I'm a breakthrough infection, and they were able to get monoclonal antibody treatment. So from what I've heard, that's been the people that I've spoken to said it was a great thing. A few days later, they felt amazingly better, and they moved past it. So then the question is, should they look to a third vaccine? Should they, if they become eligible, should they pursue that booster shot, even though they've had all those other things in line?
Yeah, same thing. They should, for the same reason. Now, something to remember for everybody that gets the monoclonal antibody, which is a therapy that is available and definitely can help if given early in the disease, is that you have to wait about 90 days to get the vaccine. So the reason is because you have antibodies that basically will neutralize, will not make the vaccine work well if you do it before that. So that would be the reason. So wait 90 days after getting the monoclonals, and if by then the indication is that you should get a booster, go ahead and get a booster.
Excellent. That's one we heard quite often. So that's a great amount of clarity we weren't able to get anywhere else. So thank you. So as we know, the flu season is basically approaching. So do you recommend a person getting both the flu shot and the COVID-19 vaccine at the same time?
They don't have to be at the same. So they can get it at the same time. And at the beginning, we were not giving them at the same time. And the main reason is COVID-19 vaccine is a new vaccine, or it was a new vaccine. It was on the emergency use authorization from the FDA. So the idea is give it alone. So in case if anybody has side effects, we know it's from the vaccine and it's not from the other vaccine or from anything else. So that was the rationale. Now that there's really no medical reason why they cannot be given together. We do give vaccines together all the time. People that are traveling, they may get 4 or 5 vaccines at the same time. So I think that as the vaccines get more FDA approval, it won't be a problem. I would recommend that people get the flu shot as well. I think that last year we had a very almost non-existent flu season because people were wearing masks and doing social distancing, and the measures that we were taking for COVID-19 were a lot more than the what we need for flu. But this year things may be different. We don't know yet. We just have to wait. But I think that it's a good idea to be protected and get the flu shot as well.
Excellent. And I think the Florida Department of Health, some of the areas in where we're in and around Osceola County, they are offering both shots at the same time, I guess. So that's what's happening where we are. So you kind of answered this already. So let's talk a little bit more about the third dose booster shot. Who's eligible? Who you think is the prime demographic to be pursuing that? I'll insert my personal life. My mom is 90, and she is super healthy, lives by herself, and that's the way she loves it. She went right out as soon as she was eligible and got fully vaccinated, and so now she's saying, "Gosh, I'm very good at being socially distant. You kids can't come over," and not very much, but. So she's trying to weigh out, should she get that third booster, and who else should do that?
Yeah, good questions. And I'm grateful for it. It's great that your mom got the vaccine and that she's doing well. So the just to talk about the booster a little bit, I know there's been a lot of talk and people confused with some of the initial recommendations and some of the back and forth between the FDA and the CDC. I think that what people need to understand, and again, I always go back to this is a new infection, and we are all learning about this together. So people, I say people have to be patient. We are all playing in the same team. There are not 2 or 3 teams. We are all one team, the humans that are fighting this virus. And sometimes you have to change strategies. Sometimes you have to adjust and based on the data make decisions. So the data that we have so far from one of the companies that make the vaccines, and also from big studies from countries like Israel that had a massive vaccination, is that a booster would be helpful in increasing again the antibodies and decreasing the rates of infection. So that is the data that is out there. So what is in question is if everybody needs to be vaccinated in the whole population, or only those that are more susceptible to, or that can have a worse outcomes. And I think that's what the FDA, at least here in the United States, decided to go first with the people that have a higher risk, people that are older than 65, and I think your mom will be in that group, and people that are immunocompromised. And then the CDC added healthcare workers because of the higher risk that our profession has. So I think that definitely I would do it in those groups. I think for the rest of the population, there are going to be a lot of people that will benefit from the booster. Whether it is necessary for the entire population, that is still in question. And I think that's why the FDA were with caution and also taking into account the be sure that we have enough vaccines for everybody. So you want to be sure and that at least you take care of the more vulnerable population first. But I would stay tuned, and I think people in general have been very responsible and listening to the news and waiting in line to when their moment is to get vaccinated. So I think that let's just continue. I think we are hopefully in the last stretch of this. Let's just stay tuned to what the FDA, the CDC, the health authorities have to say, And if the decision is that we all have to get a booster, let's just all get a booster. And if if it has to be every certain period of time, we don't know that yet. People say, oh, am I going to have to get it every year? We don't know that yet. It may be, it's possible, but we really don't know. So I would say just stay tuned and keep being responsible. And as I said before, we are all playing in the same team.
That was really well said. So should we expect, taken from what you said, should we expect that the eligibility levels will perhaps look like the vaccinations did when we were all taking the first vaccination as it steps down age-wise? Possibly, do you see that possibly happening?
I do. I think based on the experience, again from the companies that make the vaccine, as well as from countries like Israel, that's probably the best way of doing it. I think that that might be the next step.
Yeah, I again, a personal scenario. So I was one of those folks that was very grateful to the medical community for being able to come up with this vaccine. It's obviously saved lives beyond our ability to know number-wise, really. But it's not an issue for my family either. We're waiting. If the eligibility comes up for boosters, we'll go down and get our booster shots and hopefully stay healthy. And maybe we'll get back to that word normal at some point, like you said earlier.
Exactly.
So how about just a couple more questions, and I know you got to get going because you're a busy man here, but so should people still wear a mask? Because sometimes this is an issue for folks, but do you think that mask wearing is a wise move and to remain socially distanced even after you're vaccinated?
Yeah, and again, that's a great question, and mask has become a big issue. And I think the way I at this point, almost October 2021, that I would approach masking. I think that everybody needs to make their own decision. There will be situations when there will be mask mandates depending on the specific situation at that moment in a particular county or a particular city. But I think that beyond that, everybody has to make their own decisions. And I think that's what the CDC was aiming when they decided to make the mask restrictions for vaccinated people, no mask, less strict. Was that if you're vaccinated, you have protection. It's not 100%, and you mentioned earlier the breakthrough cases, and there are, it's no vaccine in the world is 100%. Over time, the immunity wanes, which is one of the reasons why the boosters have been indicated. But still, the vaccines will protect you against severe illness and death for the most part. So I think that if you're fully vaccinated, if you get a booster, and this is the important part, and you feel comfortable in the setting where you are, I think it's okay not to wear a mask. If you know the people around you, if the community transmission is very low at that point, if you are in an outdoor place, I think people really have to use common sense. If you are in a crowded place, because that's the situation, and you are in a crowded place and you see a lot of people that you don't know and you just don't feel comfortable, have a mask with you and all the time, and you can use it. I mean, there's nothing wrong with that, and that's your own decision, is your own life, and you make your own decisions. If you feel that you need to wear a mask, wear a mask. If you feel comfortable and you say, you know what, I know the people around me, they're all vaccinated, I know what they do, and then I don't feel I have to wear a mask, don't wear a mask. I think that we're getting to that point that everybody has to make their own decisions about that responsibly.
Yeah, that's again a personal thing. That is exactly how I carry myself, and our staff does. We end up in some places where we don't know everyone, and sometimes it might be a sporting event, and we find ourselves in a quick massing of people, and we just basically throw a mask on at that point. Nobody ever double takes. Why do you have a mask on? That's not what it is anymore for us. So that's our. I agree with you what you're saying. So the last question, I'm gonna ask you to get your crystal ball out, which none of us probably should do. So what, if, from where you sit now, so what do you think is the most likely future of COVID-19? I know this is not absolute, but what do you see coming up ahead? And what would you say to the audience that might be listening as far as what they can see in the next few months, maybe a year even? Where will this thing be at that point, do you think?
I mean, it's again, it's hard to predict. I think the possibilities are that either will stay with us, like it has happened with other coronaviruses, that they manage to survive and remain basically as a respiratory illness that is transmitted either seasonal or depending on the situation, but maybe to a low level, not at a pandemic levels. So that's one of the possibilities. We're talking about, let's say, we get the majority of the population vaccinated, as well, plus the people that reach out natural immunity. So we get to that level of herd immunity. There still could be some. Remember, this is in the entire world, so it's difficult to control what happened in the entire world. That is uncommon also, that something happened all around the world like this. And we can control what we do here in the United States. Each country can control themselves, but it's difficult to have a global approach and everybody doing exactly the same thing. So and I think that the most likely scenario is that it's going to remain. We just have to be careful and keep getting vaccines if it's necessary, and monitor the health authorities will have to monitor the activity and make decisions. The ideal outcome would be that it basically goes away, like it has happened with other pandemics, and when people reach when we reach herd immunity, then it goes away. There is a possibility that would happen, but we just have to wait.
Right. Well, I will close by saying that I think you said it best early on today, which is we are all on one team, and that is the team of humans trying to figure out how to navigate through this the best way we can without great loss of life. And I think it does, lots of varied opinions, certainly a big, huge world we live on and in. So I think that the wisdom is, like you said, that we need to work this together, hopefully. Listen to sources like yourself and Orlando Health, and just keep working together on this. And I think it's probably going to lend to the best possible outcome.
Thank you, Keith. It's been great to have this opportunity. I think that trying to disseminate the message and to answer any questions that people have, that we're always available here for anything that you need.
Awesome. Appreciate your time very much. Again, this is Keith with Positively Osceola, along with Dr. Antonio Crespo, Medical Director with Orlando Health Medical Group Infectious Disease, and also Medical Staff Leadership Chair with Orlando Health Dr. P. Phillips Hospital. Together, we're making a positive difference in and around Osceola County. Thank you, Doctor, very much.
Thank you, Keith. Bye-bye. Have a nice day.
You as well.
All right.